Hi, everybody. I'm Leia Swanberg, founder of Canadian Fertility Consulting, coming on live with three of my favorite people, Ellen Embury, Rachel West, Dr. Daneshmand. We are going to be answering your questions live on COVID-19 and how we are working through, I believe fantastically, every obstacle that has come against us as we move forward in helping people build their families through surrogacy with a Canadian surrogate and an amazing US clinic, in this case, San Diego Fertility Center. And so I have been sent some questions ahead of time from some of our clients or hopeful parents. And so I would love to start with you, Dr. Daneshmand. And first, someone asked me, and I know it doesn't relate to COVID, but I think it's important. If you can tell us what makes a great surrogate.
Well, I think, a great surrogate starts with an incredibly generous heart, because to me, surrogates are amazing. They are really helping our intended parents have families. So it starts with a generous heart and a commitment to wanting to help intended parents have a family. So it starts with that. Then the other issues are sort of medical and health parameters that we look at. For example, we want to make sure they're healthy, they don't have any medical problems. We want to make sure their body mass index is below a certain figure. We want to look at their previous pregnancies to make certain that there were no complications during the pregnancy. Complications such as very high blood pressure or premature birth. We want to make sure they have a supportive family. So these are some of the sort of the health parameters that we look at. And ultimately, a surrogate is someone that we can trust. We can trust with her own health because we are responsible for her health to make sure that she doesn't have any significant health problems during the pregnancy, and that we can trust her with the pregnancy as well. So those are some of the health parameters and some of the other characteristics of an ideal surrogate.
Excellent. And I know that your clinic does an amazing job of medically screening these women, which right now with COVID-19 isn't possible. So I'm wondering, how are you moving ahead with surrogates, knowing that you can't sort of lay eyes on them and physically see them for their screening?
I think every crisis presents an opportunity. So one of the things that we did with our, really with our partners here in Canada, and that is with CFC, with Ellen and Rachel, is that we came up with a remote or a local screening process protocol, meaning that the first step, in order to move the process forward and not have any significant delays in your surrogacy journey, what we're doing is I'm having an initial consultation, a video consultation with your surrogate, where I review all her medical history. Once I've done that, then the coordination between CFC and San Diego Fertility Center, we're going to order labs at local clinics and local laboratories for your surrogate. So she can start the process of doing her testing in Canada. Depending on how the border situation sort of develops in the coming months, it could be that the entire screening will be done locally. I will still be overseeing all of the results, looking at them, analyzing them, and making sure that every step of the process is followed the same way we follow them right here at our office. We have great colleagues in Canada. That's one of the advantages of having great relationships with colleagues around the world, including Canada. There's some wonderful clinics and labs in Canada that we've collaborated with over the last 10 years. So we have a great deal of trust in their screening process. I'll analyze the screening, and then what we'll do is either we complete the screening here, or if the borders are still restricted, complete the screening in Canada. Then after that, we can move on to the legal process and the legal clearance prior to the embryo transfer.
Excellent. Thank you. This next question is Rachel or Ellen for you guys. Is the suggestion now with this border closure that people complete their legal or get legal clearance, so complete their agreements with their surrogate ahead of time for screening to sort of keep everyone interested and busy while we're kind of all at home?
So our recommendation, and Rachel and I are partners and we work together, our recommendation is that it definitely makes sense to do the legal agreement ahead of time. to make sure that there is buy-in on both sides and commitment on both sides, because there may be some delays, although we're working very hard to eliminate those delays. One of the what our personal practice is that if for any reason the contract is completed and it does not go through for whatever reason, if for example the surrogate does not pass screening, which is quite unusual, we won't charge for a second agreement. And so it's important that both sides have the comfort of knowing that they're committed to each other moving forward, but there is a backstop protection which we can offer in the unlikely event that the surrogate doesn't pass screen.
And I think right now, yeah, is a really good time to be setting the foundation. So moving on with contractual pieces means that you are prepped and ready to go the minute the borders are open. And we can also engage in other aspects of the process anyway while we're waiting, such as pre-screening, things like that. So it's a valuable step to be taking so that there are no delays once the borders are in fact open.
Excellent. And are there, and this is a question sort of for all of you, Dr. Daneshmand, are there special considerations, both medically and legally, around COVID? And what does that mean for the contract? For waivers or whatever you have people sign?
I mean, that's a great question. For many of our intended parents, for example, who needed to come to Canada for the birth of their children, I think the legal team has really done an incredible job of developing support letters from the attorneys and lawyers, and also support letters from us for those particular intended parents to be able to come and be present for the birth of their children. In fact, I just had a Facebook post early this morning about our intended parents in the UK, whose journey is well known to many of you, just because they've been sort of blogging and talking about their journey. And their surrogate is in Canada, so they're actually coming to Canada several weeks early with the support of the legal team here and our support letters. They're coming several weeks early so that they can, do the necessary quarantine and then be there present for the birth of their child in their sibling journey. So the other aspect of this that we're working on is to be able to have intended parents prior to actually starting their, for example, IVF cycles, to develop potentially letters of support for them to be able to travel for medical reasons, because there are medical exemptions in many of these travel restrictions, and we're doing everything possible to see if we can use those medical exemptions, for example, to have intended parents travel to us for whether it's IVF, whether it's for egg extraction, sperm freeze. So that's another area that we're working on. And again, we're lucky to have the legal team of Rachel and Ellen, who are not only creative but extremely experienced in these areas.
And further to that, in terms of getting started with IVF and its safety, and are you all consulting with infectious disease specialists, or are clients expected to sign waivers, and sort of what does that look like for people getting ready? Is it safe right now?
Absolutely. So the American Society of Reproductive Medicine in mid-March came out with a sort of a recommendation to put a pause on fertility treatments. And the reason for that is because we didn't have enough research and studies to determine sort of the impact of COVID-19 on fertility, on pregnancy. Since that time, there have been numerous studies published in journals such as the New England Journal of Medicine, in Lancet, that have been very reassuring as it relates to fertility and in particular in pregnancy. For example, there's no evidence that the virus can get to the sperm or to the eggs and ultimately to the embryos in the process of in vitro fertilization. There was a great study out of Columbia University in New York that was published in the New England Journal of Medicine, and I recommend for all of you to take a look at it because it really followed over 215 pregnant patients. And what they found was that about 88% of those patients were asymptomatic when they tested positive for COVID-19. Another percentage had only mild symptoms, and the percentage of patients who were pregnant who went on to develop severe symptoms was no different than the general population. Both that study from Columbia and other studies from Wuhan University have shown us that at this particular point, we don't have any evidence that pregnant patients have a higher risk of contracting the virus, or if they do, that they have a higher risk of developing severe symptoms. It's the same as the general population, so the CDC recommendations for pregnant patients are no different than the general population. So that's good news. The other group of studies also showed us that there's no evidence of vertical transmission, meaning transmission during pregnancy from the pregnant patient to the fetus by the placenta. There was a great study that looked at patients who had severe symptoms. These are patients who had high fevers and who were hospitalized with respiratory difficulties. And in those particular patients, they tested the amniotic fluid, the cord blood, and also after the babies were born, they tested the nasal passages and the oral passages to detect the virus. And there was no evidence of the virus in any of those particular cultures. So at this particular point in further studies, there's no evidence of vertical transmission. So the data has been reassuring, and that's the reason why the American Society of Reproductive Medicine came out with their latest guidelines and recommendations on April 24th, and they essentially gave the green light to fertility centers in the United States to gradually resume their fertility operations.
Syed, can I ask a question about that? And so I understand that fertility treatment has been deemed an essential service. Is that in California or is that in other states as well?
Actually, that's a great question, Ellen. That's in other states as well. In fact, actually, New York, the New York Governor Cuomo was the first to deem fertility services essential services because there was some sort of a back and fro in terms of whether fertility centers in New York should be open, especially during the sort of the peak time of hospitalization. And the governor actually came out and said fertility services are essential, and that's a decision between the fertility doctor and his or her patients. Subsequently, the same sort of a group of governors, including the governor of California, came out and said, yes, fertility services are essential, and sometimes fertility treatment can't wait because that can have an impact on sort of the journey to parenthood for many, many intended parents and many patients. And the evidence so far has been very reassuring in terms of pregnancy as it relates to this particular virus. So the only recommendation that the American Society of Reproductive Medicine made was that all fertility centers should put in practice mitigating measures in order to protect their patients and team members. So for several weeks, for example, if you come to our office, there's one way sort of traffic, meaning one way to enter the office and one way to exit the office. Every team member is wearing a mask. We're actually providing masks for all of our patients, anyone who enters the office, and only patients are allowed to enter. And everyone's wearing a mask, everyone's wearing gloves. We're sanitizing all the surfaces every several hours with Lysol-based products. So we're really taking every precaution. The situation has been very stable. Most states in the US have actually sort of reached the plateau of the curve. Now we are going to have spikes of sort of second waves as states start to come out and emerge from these lockdowns. But right now there's a great deal of optimism that those spikes will not be at a point where it's going to overwhelm the healthcare system. So we feel very positive. And I posted some videos on my Facebook page in regards to upcoming vaccines. There's a group actually out of Oxford University that's working on an incredible vaccine that they think it's going to be so effective that they've already started manufacturing the vaccine globally. And they think that the vaccine may be ready as early as September or October of this year. So I think there's a great deal to look forward to and a great deal of optimism. And I think that with sort of community support and with good science, we're going to get through this.
Excellent. Thank you. Ellen or Rachel, many of our clients are asking if there is anything that will change in terms of their contract regarding COVID, if you'll be suggesting that people wait, or if you will be suggesting that people travel, as soon as they can, hoping to get ahead of any, potential spikes that we hear may be coming in the fall.
Yeah, so I think it's really important for surrogates to make that decision themselves with their medical professionals and based on their comfort level. But I think what we're hearing is the messaging that Dr. D just discussed with us, is that for the most part, safety is absolutely a priority, and we are seeing that safety is being preserved. And so I think there is some really positive messaging about the fact that, yes, we can move forward with this. We are trying to find creative ways to ensure that these processes are not delayed. And so I think that each surrogate obviously needs to make that choice with her own comfort level. We as lawyers are here to assist in that comfort level and would never push, beyond something that they're comfortable with. But we always have an eye on the medical professionals and what they are recommending. And if they are recommending that this is something that we can do, then I think it's absolutely for those who are comfortable doing so. I think it's fine to proceed within the bounds of the law and within the bounds of the medical caregivers' recommendations. As far as contractual changes that we're seeing, there's not significant contractual changes. It depends largely on what the agreement said anyway, as far as timing of how long the relationship is in place, whether that timing is tied to the first transfer date or whether that timing is tied to the signing date. We're making some adjustments there to ensure that if there is a delay, the delay isn't affecting the relationship. But Ellen, maybe you want to add to that?
Yeah, I think that the one key clause that we are changing is the new reality is that if there are, we put a clause in that says in the unlikely event that one of the intended parents cannot be there for the birth, we want to anticipate how that's going to work. But there's been a group of lawyers, we've been working very, very cooperatively with a large group of lawyers across the country who have implemented a system whereby anybody who has a birth between now and August is obtaining a letter through the federal government, and I always get the department wrong because it's immigration, refugee, and citizenship. So they're getting a letter saying it is necessary for those individuals to be in Canada, to be present for the birth of their child. They meet the exception. And what we're now working on is exactly the same thing to get surrogates across the border to the US, which is a letter from Dr. Daneshmand saying, this is an essential service, this is my patient, this patient needs to be here, and ensuring that there's a seamless transition across the border for surrogates to go there.
And a follow-up to that, Ellen, would be, if a surrogate decides, yes, I feel super comfortable without undue pressure from anyone, she's ready to travel, we've got these letters, we've got everything for her, she travels, she has the, completes the embryo transfer and comes home. And, as many provinces are managing this individually, and her province says, hey, you need to self-isolate for 2 weeks, you've been in the US. What does that look like in terms of sort of who's responsible for the cost of her self-isolating in terms of maybe her employment, her childcare? Where are we on that?
So that's an excellent question, and it could be a requirement of the province, but it could also be a requirement of her employer. And so we get into our other specialty, which is employment law. The answer very simply is that, and we've had a number of intended parents ask us, if I want my surrogate to travel, if she's required to quarantine for 2 weeks, is it legally allowable for me to cover the wage loss costs during the 2 weeks when she comes back, when she's not permitted to work? The answer would be yes, if there is a medical note from a medical practitioner that says that she's required to quarantine for 2 weeks due to public health restrictions, which could impact her or the baby or the fetus. So the answer is yes with a medical note. The second element would be, well, if the employer is paying her to be home for 2 weeks, then obviously there's no double dipping. So the primary burden would be on the employer in that case, but the employer does not have an obligation to cover her wages for what is essentially an elective trip to the US, notwithstanding that it's an essential service there. So the answer really is, in every single case, we need to look at the facts and make an assessment, but intended parents should be prepared to understand that if they're asking her to travel, if she's comfortable travel, if we have all of the consents in place, as long as there's a medical recommendation that she needs to take that 2 weeks off, that would be in compliance with the Canadian law.
Okay, perfect. Dr. Daneshmand, I have one last question for you, and then we'll take questions. If anyone on this live has questions, please type them below, and we'll absolutely answer them. With, earlier you mentioned that only the patient can be in the clinic. Does that mean that a companion who would normally accompany a surrogate for an embryo transfer wouldn't be able to? And what does that kind of look like?
I think, sort of this is a situation that is rapidly evolving, so things can change. Right now, we're sort of we're trying to sort of distance the appointment times so that only one patient is here at a time. And I think that's really worked well. We're at this particular point, we're suggesting or recommending that if a patient comes in, that her companion would wait outside the clinic, just for protection of the patient herself, and for the other team members and other patients as well. So I think we will take each individual case into consideration. So I think if there's a surrogate that, in terms of her comfort level, her confidence or comfort level, she really, requires somebody near her at the time of embryo transfer, then, we can look at that particular case, and we can, obviously we're providing masks, so we're providing all these public health measures, and I think we can make exceptions in those particular cases.
Okay, perfect. And I have one question that was just sent to me, and then we can get to any questions that are on the live. The question is, and they're not a patient of yours, so they understand you may not be able to answer this, but they are beginning an IVF cycle, and their physician has suggested that they take a medication called Medrol, which is an immunosuppressant, they understand, and they wonder if, with COVID happening, if taking an immunosuppressant is a bad idea.
So typically, Medrol is used in sometimes for embryo transfers. Sometimes it can also be used for IVF cycles as well, but it's used at a very low dose in a very short duration. So that low dose and short duration should not put you at risk for any immunocompromise that can increase your risk of, for example, not only contracting the virus, or if you did, to cause an increased chance of having severe symptoms. So it's safe to use low dose for a short period of time. Now, we typically don't use Medrol because when you look at the research studies that have been done, there's no evidence that really Medrol improves pregnancy rates or decreases miscarriage rates. So the research studies don't prove a benefit, and that's the reason that I haven't used it specifically, for example, at the time of embryo transfer during IVF cycles.
Okay, perfect. Thank you. Jordan, are there any other questions on the Facebook Live below?
Hi, Leia. Yes, one person's wondering, do you have any idea when they can expect flights and travel to become open between Canada and the US to travel down to SDFC for screening transfers?
Ellen, I'll let you answer that question.
So the answer is there are flights available. The question is whether or not it's going to be possible to travel with a permission to travel letter from a physician in San Diego indicating that it's necessary to travel for an essential service. We are aware, I think, Leia, there is a plan to send a surrogate down from BC, I think, in the next 2 weeks. Essentially frankly, as a test case, so that we can get the letters in place and we can see how the U.S. border authorities react. And our hope and expectation is that it will be successful, and we'll be able to report back to you, or CFC will be able to report back to you when it knows whether it was successful, notwithstanding the current border closure.
And as an agency, our goal for any of our surrogates traveling, whether it's within Canada, whether it's into the US, is to really limit the risk. So to ensure that, the surrogate is traveling by car service to and from the airport, that she's staying in a hotel that has a really comprehensive COVID-19 sanitation process, that, they are going to the clinic, not by shuttle, but by car service back to the hotel. That we are choosing the least traveled flight path and plan. And we've been spending a lot of time within our logistics department, really putting thought into every single detail for every single upcoming client, traveling, as I said, within Canada or the US, because we want to ensure that we are limiting anyone's risk. And we will have news and an update, in 10 days or so on how the process worked, having someone travel. Because for us and for all of us on this video, we want to ensure that we are able to provide you all of the information that you will need to present at the border. We will, help you to understand sort of how to navigate that piece. We work with amazing immigration lawyers that have just really been fantastic and supportive. So we will ensure to update on the page as soon as we have that information.
Amazing, thank you. And for a few viewers who have joined us partway through, they were just wondering if you could each go around and introduce yourself and which companies you're with.
Absolutely. My name is Leia Swanberg. I'm the founder of Canadian Fertility Consulting, and am happy to connect with anyone that's watching this video to talk about either your journey to parenthood or becoming a surrogate in our program.
I'm Dr. Daneshmand. I'm a fertility specialist, and I'm at San Diego Fertility Center.
And Rachel and I are law partners. We run Western Canada's largest surrogacy and fertility law practice, which is Carbert, Waite, LLP. And like everyone else, we're always happy to have a Skype call or a free consult to answer any questions that you may have that you're not perhaps comfortable posing in a public forum. So we're always happy to do that, and there's no charge at all for those consults.
Hi everyone, I'm Rachel West, and yeah, as my partner Ellen said, we run Western Canada's largest law firm with respect to surrogacy and fertility. I'm fairly certain that Jordan will have tagged us in the bottom of this Facebook Live, so if you would like to, feel free to visit our Facebook page or our website, which is canadafertility.org. And as Ellen mentioned, we're happy to answer any questions at any time with no charge.
Okay, that's everything. Thank you so much.
Excellent. Thank you.
Thanks, everyone.
Thanks.